So I know that we all work and know that we work in sort of a HIPAA environment, and we've had conversations about HIPAA in the past. And Ben Motley is joining us, as you can see from his fancy home conference room, as we just mentioned. And so Ben is the compliance specialist at Intermed and is moving soon to be the compliance and privacy officer for Blue Hill and Maine Coast Hospital. So he starts there. I don't even know when his start date is yet. I'll have to catch up with him later on that. So he's actually going to do a training in relation to HIPAA. Our hope is to now do this as an annual training for all. For those who aren't here today, we're recording it so that they can watch it. And part of this training after this training, Kristen is going to email out to everybody a document for you all to sign that you have taken the training today and or then have watched the training at a later date. So that will go then into your personal file for her. So I'm gonna, rather than, I think I'm gonna skip introductions at the moment, and you guys can introduce yourself as you have questions. But this is, Ben and I have talked about it in relation to it also being discussion oriented. So this is really for you to be able to pick Ben's brain about issues that he may have seen in the past, and he has seen them all. Well, maybe not all, but will at some point in his lifetime. So he's going to start. I don't know, Ben, if you want to share your screen or if you want me to share your slides for you.
Sure. Yeah, no, I'm happy to. I wasn't sure if I have that ability, but why don't I share mine?
And if I missed anything on your intro, Ben, feel free to fill us in.
No, you nailed it. Thank you. All right. Is it showing now?
Not yet.
Okay. There we go. All right. See if I can pull you all back up now. We use Teams at Intermed mostly, so yeah, not a Zoom expert. All right. So my screen is still showing. Everybody can see the slide?
Yes.
All right. Awesome. Well, thank you for having me this morning. It's been fun to talk to Lisa a little bit about Dempsey Center and all of the different things that you all offer. It's a pretty impressive collection of programs, and you interact with clients and patients in all different ways. So I think Lisa felt like it would be helpful to you all to have just kind of a broad overview of HIPAA, and as she said, just opportunity to ask questions about your particular environment, your day-to-day, or things that you might see, so that hopefully you can be more confident in sharing information and what's appropriate and what's not appropriate. So I'll start by running through the slides that I have, which I don't think will take too long. Please feel free to interrupt me as we go if you have questions. But hopefully this will give you an overview if you haven't had HIPAA training before. And then we can go from there with a couple of scenarios. All right. So to start with, and this is probably not information that you need to memorize, but just to be aware, HIPAA has been around since 1996, and the idea behind the HIPAA law was to provide a kind of standard set of expectations for sharing patient information for any organization that falls under CMS, the Center for Medicare and Medicaid, created these guidelines, expectations, so that hopefully everybody is at least staying to the minimum requirements of HIPAA. States can have more strict laws than HIPAA, and some do. Maine, for the most part, follows in lockstep with HIPAA. There's a couple of differences, but probably not anything that you need to be concerned about. But there are a few different parts to HIPAA. There's the privacy law, which is probably what we talk about most when we're talking about HIPAA, and that's just defining what is protected health information, what of your health information is protected. There's the security law, which says how do we need to protect this information, what safeguards need to be in place, and then the most recent or more recent update is the HITECH Act, which pushed organizations to an electronic medical record, and also provided funding for investigations of HIPAA violations, privacy violations. And so now there are actually monetary penalties for organizations that are found to have violated HIPAA. So that is part of the reason why we're here today, is because it's good to be aware of expectations and try not to be acting in a way that's counter to HIPAA requirements. Questions on that overview? Right. So ideas around what is considered protected information. We talk about PHI, the protected health information. Does anybody have thoughts on or a good definition for protected health information? It is early in the day.
Shout it out, people. There's no wrong. Well, there might be a wrong answer, but we want to know it if it's wrong.
Anything that's
Yeah.
I was going to say anything that's identifying name, address, phone number.
Okay, so so that is definitely one piece of it. Those are the HIPAA identifiers. Those are the ways that we identify the health information. So that's definitely a important piece of it. In terms of the actual health information, are there other examples of
diagnosis?
Diagnosis? Definitely.
Medications,
absolutely.
Jerry, you were about to say something. I don't know if that was already covered by what you wanted to say.
Yeah, Michelle, just the last training I had of like any personal identifiable information, I think was how they phrased it. So.
Okay. Yeah.
About the fact that whether or not someone's even a client or a patient.
Right. So just knowing where somebody is being treated, the name of a facility or a provider, definitely. Good. So I think we've got the idea. So the way I like to think about it, if I'm looking at a patient record, it's safe to assume that any information that's stored within a patient's record is going to be considered protected health information. So it's anything to do with their past, present, or future treatment, anything about their delivery of care. So even something as simple as an appointment card that shows that I have an appointment at Dempsey Center or at Intermed, that's those pieces are also protected health information. I think less relevant to your environment, but anything around billing for healthcare is also kind of gets wrapped up into PHI. So it's kind of a all the above thing. It's safe to assume that if it relates to their healthcare, it's going to be considered protected. Are there questions on that? Right. So then the other category that Michelle mentioned, HIPAA identifiers. So these are the ways that we connect a patient's health information to that patient. Michelle named a few. Any other examples of identifiers that you might run into? That definitely name.
Medical account number, maybe?
Yep, definitely.
Birthday.
Birth date, absolutely. Good. So yeah, HIPAA identifiers are pretty inclusive as well. It really is anything that in any situation could potentially connect you to a individual patient. So in some environments, a license plate number would not necessarily allow you to identify a patient, but if they have a very unique vanity plate, then it might allow you to. So one example I was thinking about that might be more relevant to an organization like the Dempsey Center is that last one on the bottom, the full face photographs. I think that is one that folks may not automatically assume is would be considered an identifier, but if you're using patient or client photographs for marketing materials or materials meant to promote the organization, it's really important that you have that patient's authorization to be using those photographs, because even just putting a patient photograph with no health information on a poster or a flyer can connect them to the organization and suggest that they are receiving treatment or using your services. So that's a good one to keep in mind. Any other questions on identifiers? Right. So you have your PHI, which is the actual health information. PHI by itself is not necessarily dangerous if it's gets into the wrong hands. But once you add those identifiers that actually allow you to identify the patient, that's when you definitely need to be more careful. And it's pretty rare these days with an electronic health record that you're not going to have some kind of an identifier included with patient health information. So areas that PHI is stored used to be that it was stored in a hard copy record that was probably in a file cabinet somewhere. And if somebody wanted a copy of that, they would have to go to a copy machine and make a physical copy. And you'd still only just have that one extra copy. These days, with everything being electronic, it's very easy for that information to be copied and to be shared. So it's really important to be aware of the number of different places that you may be inadvertently storing patient health information, and to try and make sure that it's only being stored in secure locations. So things like thumb drives, CDs are on the riskier end because they can be easily lost or misplaced and can get into the wrong hands. Laptops too are easy to pick up a laptop and take it out of a location. And then likewise, a lot of things are stored in the cloud these days. So it's important to know if you're using an application that stores information in the cloud, that it's in a secure location that's not going to be easily accessible to people outside of the organization. Questions on storage? And these are all examples. There are ways to acceptably store in any of these locations. You just need to make sure that you have appropriate safeguards. So things like encrypting a thumb drive if you're going to store information on a thumb drive. All right, so most of the time when you hear about HIPAA, it's generally to do with a breach or some accusation of a breach. Does anybody have a basic identification or definition for breach? When is something considered a breach of health information?
Unauthorized access?
Yeah, that's a great example or great summary definition. And it's unauthorized access into what or what information?
Protected health information?
Yeah, exactly. And specifically protected health information that has patient identifiers attached to it. So if you have a stack of lab results that gets lost, but it doesn't have patient information or patient identifiers on it, that would not be considered a breach of health information. What's the other key piece of a breach? If I work at Subway and I come across a sheet containing lab results with somebody else's information with it, and I go over to Lisa's house and I share that information with Lisa, is that considered a breach? Even if I don't, if I have nothing to do with the healthcare organization that created the information, still would be a breach. Okay, so that's another piece of in order to fall underneath HIPAA, you need to be considered a covered entity. So an organization that actively stores or shares or uses health information. So although it's inappropriate sharing of health information for somebody, some individual in the public to come across health information and share it, it would not be considered a HIPAA breach because they are not bound by HIPAA law. I see there's a question, Kathleen.
Hi, yeah, I just wanted to ask about the example that you just gave and see if there's something to parse out between, like I understand why from the client or patient's perspective, the example you just gave of somebody outside the organization finding PHI and then using that would be a breach. Is there, in that particular example, does the organization responsible for generating that PHI bear any kind of responsibility for that breach? Because we were not involved in it. That person took the PHI off site, left it somewhere, and then somebody else took action on it. So I just want to think that through.
Yeah, no, that's a good question and good clarification. So it would all depend on how the information ended up sitting in a restaurant where members of the public would have access to it.
So you're talking about personal accountability as a member of the public for being safe with information that we identify as PHI related.
Yep, and again, so a member of the public is not bound by HIPAA in the same way that you working at a healthcare organization would be. So if the information ended up in that person's hands because somebody from the Dempsey Center brought it to the restaurant and left it there,
got it.
That's when the Dempsey Center would bear some accountability.
Yes.
But if a patient or client leaves your location with a printout and they leave it there themselves, then you would not be responsible for that. hopefully that helps to
Thank you.
clarify.
Just putting that piece together.
Yep,
Like, would we have
definitely.
to report that breach even though we bear no responsibility for it if
Right.
the patient had taken it off? But I do understand if it was our staff and it happened on our watch, that would be something that we'd have to have a process for internally.
Exactly.
Okay,
Exactly.
thanks.
Questions on that? All right. So this is a more formal definition, but so it's unauthorized disclosure, as Jerry said. So anytime an unauthorized disclosure, as you all probably know, could be internal within the organization too. So if somebody is sharing information with colleagues who have no need for that information, that could still be considered a breach, even if all of the information is staying within the organization. More commonly, it's when that information ends up in the wrong hands outside of the organization. So something is mailed to the wrong address, or somebody is able to gain access to your systems that store patient information. Those are kind of the more common examples that you hear about. And there are specific notification requirements, and it depends on the scale of the breach. If it's includes less than 500 people, the notification is directly to the people affected, as well as a annual notification to DHHS. If it's greater than 500 individuals, so if you have a larger data breach, then there are additional reporting requirements above and beyond notifying the individuals affected. You have to notify the media and other outlets to make anyone who could be affected aware. Those are definitely the breaches you want to avoid. Those are the ones that can have negative reputational impacts. For clients or patients that may use your services, having a large data breach may deter them from reaching out or making use. So no breach is a good breach, but it's those larger ones that are especially can be damaging. Questions on reporting? Right. And then the monetary penalties that I mentioned in the beginning, breaches can also be quite costly if it's determined that the organization did not have appropriate safeguards in place to prevent them from happening. So it ranges from whether it was something you reported immediately and the breach was accidental, to something that involved willful neglect, that somebody within the organization was intentionally sharing information to benefit themselves or to cause damage to an individual. So good to be aware of that as well. And then not hard to find examples of HIPAA breaches in the news. And again, these are, I show this just to think about just the reputational impact of having a breach within the organization. Your clients or patients depend on their information being protected. They may depend on it being totally anonymous, and when they see something in the news, it can cause negative impacts on patient or client trust. So there's also that piece to consider. So just a few things that you're all probably aware of. Simple things you can do to prevent breaches, and a lot of these are aimed at preventing those more significant breaches. But the first one on the list there is just making sure if you're sharing information that it's going to the right person and that you have authorization to be sharing that information. Need to know basis. So a big piece of HIPAA is that folks that want to access protected health information need to have a need to know, and B, a right to know. So need to know would be that you are involved in the treatment of a patient or involved in scheduling a patient's treatment or services, or you're involved in the billing for their care. And a right to know would mean that you have appropriate authorization from that patient to be accessing or sharing their information. So there are certain areas where you don't need to specifically gain the authorization of a patient. If you are treating them, there's a implied consent there that they are okay with you accessing their information. But if you would like to send their information to a third party, like one of your vendors, or to their uncle that requests it, those are the situations where you need to make sure that you have that patient's authorization to send that information or share it. Questions on that one?
Not a question, but just a story. A couple of years ago, those of us who are in the Lewiston area will remember there was a youth who took her life, and there was a lot of reports in the news and the media about a mental health organization that didn't serve the family's needs, and all sorts of stories around that. There were several people who were employed by that organization who didn't have a need to know that accessed that record out of curiosity, out of just wanting to know the whole story and who was involved. And they lost their jobs because of it. The system knew who had accessed it, who had a need to know and a right to know, and who didn't, and terminated those employees who did not need to know. So
yeah, that's
it can happen pretty innocently, but we all think that perhaps because we're employed at the Dempsey Center, we should be able to see all of that information, but that's not the case.
Yep. Yeah, that's absolutely true. And we'll get into that a little bit more in one of the scenarios, but it's really important to know that just because you have access to information does not mean that you have a right or a need to know that information. So the other two on the have on the list is just if you have a workstation that's accessible by clients or patients coming through, that you are securing that in some way when you're not at the workstation, so that somebody can't just pop in and search around or print information. And then the last one is to promptly report. I believe, Lisa, are you the official privacy officer for the organization?
I am the official, yes.
Yes, good. So if you suspect that information went to the wrong place, you don't have to determine that it was a breach of information. Always better to report that to Lisa, to say, I'm not sure if this was okay that we shared this, or this may have ended up in the wrong hands. Always better to have an investigation, find that there's nothing to be concerned about, than to kind of ignore it and then have the patient or client discover it and submit a complaint to the state or to the federal government, and then have it found out that you never did anything about the information, even though you were aware of it. So always good to report. And Lisa, is there a specific way that folks should report, or
Just
phone call,
reaching out.
email?
It's a great question. Just either call or send me an email that we need to touch base about it, but don't put any identifying information in the email about what you want to talk to me about. Right. So that's sort of that kind of double-edged sword of reporting, but making sure it's not identifiable within that email of what you're, unless you encrypt the email, which we have the ability to do in our organization to say it's confidential.
Great. Good. Yeah. So it's okay to talk about what might have happened, but you don't have to connect it to a specific person. Include those identifiers. All right, and along the same lines, some communication basics, which we should use at work in our personal lives as well. Secure communication methods when you're talking about patient information, just like we just mentioned. Texting back and forth with somebody about a specific client or patient is not a secure way to discuss patient health information and should be avoided. Obviously, any type of social media, you want to be very careful about what you're posting, and that it doesn't allow for the identification of a specific individual unless you have their authorization. The primary source of a major data breach these days is a phishing email. Something like 80 to 90% of large data breaches are not somebody that used sophisticated technology to hack into a system. It's somebody that through a phishing email is able to get is given by somebody credentials to log into systems or to the network, and they just have easy access to that information. So any email from outside the organization that's requesting password resets or patient information, definitely treat carefully. And if you have any doubts, check with Lisa first before opening any attachments or clicking on links.
And I'll just share, Ben and I talked about this example that happened actually last week. I got an email from Claire Cody, who's the COO of New England Cancer Specialists, that asked me, and you may, some of others of you in our organization may have gotten one, asked me, it even said in the email, trusted email. And then when you looked at the email, it asked you to log into the New England Cancer Specialist website. So, and there's no way that, why would I need to log into their website or their portal? So just recognizing sometimes you do actually, and I did, and I was telling Ben this, I went to her email to double check the actual email address, and it was the same email address. So it was her email being used for that purpose. So being mindful that you may even know the person, and Ben and I have had instances where it's come into the organization where you think you know the person, and it ends up sending out a huge worm into the system looking for that phishing or that information if someone actually logs in. So just being really mindful whenever in doubt. And if it always has that like, why am I getting this email? And don't open it.
Absolutely. You can always pick up the phone and call the person. Good litmus test is if you would not be comfortable picking up the phone to call the person to check with them. If it is a legitimate email, then you should probably be thinking twice about clicking on any attachments, because generally we're not just getting a random outreach from somebody that we don't know well with an attachment or a link attached. So
and we have a question from Jackie about who do you want us to report? Do you want us to report those, and who do we report to if we receive those suspicious emails? And so Jackie, and I know Heather's on here and Cheryl's off today, but what I've done is report them to Cheryl to let her know from the system side. So you can certainly send them to Cheryl and CC me on them, but Cheryl would be the one that we'd want to let know that you're getting some sort of, or just to clarify, or so that she's aware that we're starting to see some higher incidents of phishing emails.
Yeah, good to report those, because if you're if you're getting those messages, somebody else probably is too. So helpful to make everyone aware.
An additional question from on that was when we do send them to Cheryl, do we write something in it like, hey, don't open this?
Yeah.
So I don't know what you guys do at Intermed, Ben, but
Yeah, so we use a specific breach at intermed.com email address. So you could consider if Cheryl can set up just a shared email address, that might be a good idea, so that anything that goes to that, it can be assumed that it's suspicious. But otherwise, definitely put a little disclaimer on there. Don't just forward the message.
so the one I used Maureen with last week that I got, I just put in the subject line questionable phishing attempt and then forward it so that it was in the subject line to Cheryl ahead of time.
Perfect. All right. So bottom line, the bottom bullet here and the bottom line, if you have any question about accessing or sharing information, the person to speak with is the patient. You can never go wrong by double checking directly with your patient or your client, getting their permission, even if you don't think you need authorization, and having that documented somewhere that they authorize this information to be shared. That is always going to be your best safeguard. If the patient has authorized it, assuming they are an adult and are able to make decisions for themselves. Otherwise, if their parent or guardian authorizes it, you're generally going to be pretty safe. So I think sometimes we get way into the weeds and overthinking these situations, and good to think through potential issues, but sometimes it's just as simple as picking up the phone and calling the individual and just double checking with them. All right. Questions there? I think we have, yeah. So now I have a couple scenarios that I'll I'll read over and I'll ask you all to respond. So the first one is your coworker is passing through the lobby, sees a patient or a client who's an old family friend. They approach you knowing that you're providing services for them and ask why they're being seen, what services they're receiving. So the question is, how do you respond to that request, and what information can you share?
No information can you share? And you'd probably just respond that it's a privacy policy and we're not able to share that information.
Yeah, I think that's pretty good. Yeah, unless they are somehow involved in the care as well, and you want to discuss that aspect of the care with the person. It's even if they're coming from a standpoint of just being concerned about that person, that is not a legitimate reason to be able to access that person's information. We never know what outside relationships exist, and so better not to share anything, and just explain that you need to respect that person's privacy.
And the other piece about that, Ben, this is definitely something like this has happened before, or I have been the individual who's aware of the person in the lobby. And there's also this ethical dual relationships piece that we manage and navigate about what is in that client's best interest in terms of identifying ourselves as part of their orbit. And, how do we put their needs first as opposed to our own? So that's also woven into this particular example, and is something that we talk internally about from time to time.
Absolutely. Yeah, that's a good point. And even just if you're walking through a lobby or a waiting area and you see somebody who you're familiar with, who you may know by name, probably good to think about maybe not walking up to them and saying hello or how are you and calling them by name. It can be a tough judgment call. Obviously, if they look up and smile and say hello, you can take that as permission to say hi. But generally, when you're within your work realm or healthcare realm, you need to treat them like any other patient and respect their privacy, respect that they may not want to be identified in that situation. All right, so it seems like that one's pretty clear. Second one. So a patient or client who you have seen in the past for counseling service is on the schedule to be seen by a different counselor. You had a good relationship with the patient client and are interested to see an update or hear an update. Is it okay for you to go in and look at their most recent treatment notes or appointment summaries? And can you ask their new provider for an update? So I'm seeing
no's from
Yeah,
head
seeing
shakes.
some head
Nobody's
shakes.
speaking up.
It's not a need to know for you.
Great. Yeah. This is a trickier one because I think there's a tendency to say, if you've been involved in the care and have had access to their information in the past, that it's probably okay to go into that record again. Like I think Karen was saying, these are the situations where nobody may notice up front when it happens. But if down the line, God forbid, something happens to that patient and there's an investigation and somebody wants to see a log of any access into the record and your name pops up in that log and you are not connected to their treatment at that time, that can really become an issue. So, and it's also just a matter of respecting that individual and respecting that unless you have a need to be accessing their information, then that information should remain confidential.
And I know Michelle's on here too, and in the sense of like, I'm just, from a counseling perspective, and Jackie's on, if it's something you then are doing in clinical consultation with one another in relation to taking care of that patient, then it becomes a need to know rather than just hopping into the record to see what's going on or getting an update on how they've been since you last saw them, as opposed to needing to do an actual clinical consultation with another provider, which is what Ben was talking about in the event of needing to treat. There's an implied consent there because you're both working with that particular client. And so, and as an FYI, for those with access to MindBody, we do have this functionality of looking in the back end to see who's been accessing records. So this is not specific to just an EHR. You can do that typically with any type of software to see who's accessed records in the past. So just as a side note in saying in agreeing with Ben that if there was something that were to pop up anytime, you can go back in and look at records when you're doing an investigation to see who's accessed it.
Definitely, but the point about when it becomes a consult reason versus just a curiosity is a really good one. There are plenty of situations where even if you're not directly treating the patient, if their treating provider asks for your consultation or your opinion, at that point, it's certainly where you're within the same organization, it is appropriate for you to be to access that information. So it's a bit of a fine line. Do we have any other comments? I think those were all. All right. So that was kind of the broad overview. Are there other situations? Christy, is that a new hand?
Yeah.
Crystal, sorry.
I have a question.
Yeah.
What if like we've had like a referral, someone who refers somebody and then they call to get like an update to make sure like we've reached out to them and we've given them services?
So if the patient has been, and are you somebody refers the patient to you to Dempsey Center is what you're asking?
Yeah.
Crystal, to clarify, are you asking if it's I'm going to clarify if it's a healthcare entity calling you or the neighbor calling you asking
No,
if they've utilized?
no, like a doctor's office like refers a patient,
Yeah.
then reaches back out to us to say, hey, did you complete services for this patient?
Yeah, that's a good question. Generally, that referral creates a link or an implied authorization from the patient so that it's acceptable for you to share information, assuming that it relates to the reason for the referral. So if not relevant to your setting, but if a foot and ankle doctor is calling a physical therapist practice and is asking about a heart condition or about mental health, in that situation, it's not going to be appropriate generally for information to be released. But if they're calling about information specific to the reason for the referral, and if they've been scheduled or if they're still in treatment, then it's appropriate to share that information. Good question. Maggie, is
Okay,
your hand
Maggie,
up?
yeah.
Yeah, hi. We do classes online where people are on camera and they type their name in.
Mhm.
What are the considerations with requiring people to have their camera on and their faces so their faces can be seen?
In terms of making sure that the person you're talking to is actually the person whose name is on the screen?
Well, or if the person wants to protect their privacy by not showing their face, are we allowed to require people to turn on their cameras during, say, a class that we offer, a virtual class that we offer that's on Zoom?
So that's a good question. And I would say, are you allowed to require it? I would say, if you make expectations very clear before that person is participating in the class, to say that we respect that some folks may want to stay anonymous in this particular class, we do have a need to see people's faces. So if you're not comfortable showing your face, this may not be the appropriate class for you. I think there are ways to go about it where as long as the folks that are participating are very clear on what the expectation is. But I would wonder if there are situations where you really do need to see their face versus it being okay for somebody not to use their camera. And I'm not sure if you have a specific example in mind where it's difficult to have the person participate where you can't actually see them.
I don't really have a specific example in mind, but we offer some classes that are kind of somewhat didactic in nature that don't require participation, like active participation.
Mm-hmm.
And I wonder just that's the example I'm thinking of.
Yeah, and in those situations, it seems like you have the flexibility to allow the patient or client to make the decision for themselves that if they don't want to be seen, that's probably appropriate. But I think it's all about just being clear on the expectations and not surprising somebody by saying, "Oh, and by the way, we need to have your video on at all times."
Thanks.
Yeah. Other questions or scenarios that are specific to Dempsey Center that we didn't cover? Michelle?
I do have a question. It's common for volunteers to help, and of course, I know we'll share this training link with the volunteers as well. One thing that kind of comes up occasionally for them is when they're making reminder calls to patients about their appointments. Hi Jane, your appointment with the Dempsey Center, leaving a message, your appointment with the Dempsey Center, it can get kind of tricky. So what is your suggestion around that?
Yeah. So I don't know what you use or if you have any kind of a communication sheet that you ask patients to fill out. But I think that's probably your best bet is just to have a basic communication preferences sheet that says, is it okay for us to leave a message? Is it okay for us to leave an extended message? Just so that you have a sense for what phone number you're calling. Is it a home phone number or a cell phone number? And B, what the patient or client is comfortable with. So it's not a privacy violation to leave information on a message. But if the patient has specifically told you they do not want information shared on a voicemail, then you do need to be careful to respect that. And obviously the other piece is just making sure that the voicemail you're leaving a message on is in fact that patient's voicemail. So these days, a lot of people don't have a voicemail message, and that's tricky if it's just reading the number back to you. If you have any doubt there, definitely I would lean towards not leaving a message and calling the patient back than risking having that or just leave a very generic message like, "This is Michelle calling from the Dempsey Center. If you could give us a call back at your convenience, that would be great." So then you're not leaving any information that would identify the patient or the services that they're receiving.
Thank you.
Follow-up question to that. Because we serve people who are impacted by cancer in a number of different ways, if we're just calling or even sending mail with our, return address, because we're serving people with cancer, without cancer, their friends, their family, caregiver, is there any obviously if a volunteer called and said, as a cancer patient, I'm calling to remind you of your massage for your cancer side effect, obviously that, but simply identifying as the Dempsey Center, is that in and of itself breaching some privacy because of a variety of folks?
Yeah, good question. I think you're generally pretty safe to send whether it's a promotional mailing or just a flyer outlining services. If it's generic and doesn't include specific information about that client or patient, I think you're generally going to be pretty safe there.
Same with leaving a message, is Michelle's example, just identifying, calling from the Dempsey Center to remind you of your appointment. Is that in and of itself?
So that's a little, go ahead, Lisa.
I was gonna say, that's a little different than what Ben said. Ben didn't include the appointment. He only included, this is Michelle calling from the Dempsey Center. Can you give us a call back? So there was never an identification of the why I need you to call me back. It's just, can you call me back? And I would say the same in relation to the flyer pieces that Ben's talking about, is that because we have people who donate to the center and we have people who participate in the challenge, there could be multiple ways somebody is interacting with our organization, not just because of that cancer impact. So as long as it's generic enough, then you are covered. And I would, looking to Ben to verify that. But in my mind, you would be covered in the sense that you haven't identified that person is a client nor any service that they will be using.
Right. I think because Dempsey is so broad in the services you're offering and the population that you're serving, just seeing a flyer with somebody's name attached to it is not going to tell me a lot about their specific health information or what they may be, what their relationship to the Dempsey Center may be.
So we have about 5 minutes left. So any burning last minute questions, now would be a good time for that.
Are there any opportunities to sort of ask follow-up questions as this percolates of Ben?
Boy. Yeah, I was going to say, I'd probably definitely feel free to reach out. Probably your best bet is to reach out through Lisa. I don't have my my email's going to change soon, but yeah, feel free to reach out if you run into a unique scenario that you want guidance on. I always like the tricky questions, and it helps me to think through different situations as well. So
I have a few data management related and data aggregation related questions, but I don't think they would interest anyone else.
Yeah,
so I'd
sure.
rather just follow up offline.
Definitely. Sounds good.
And the only other thing, if there's not real specific questions, just more as a follow-up. So yes, exactly what Ben said, just if you guys have follow-up questions, send them to me, and then I'll likely compile them all and then email them all at once to Ben, not to, inundate you, Ben, but maybe we'll just slowly throw them your way.
Sounds good.
And the other piece to keep in mind for our organization is, and I think the one piece that we didn't necessarily touch on, but just so that you have in the back of your mind, is that you don't go from breach to termination of an employee. There is in between that, there's always an investigation that transpires related to what may have happened in relation to what that breach is, and to some of the things Ben had said before, like sort of the willful neglect versus the, oh my God, I had no idea I did that, so there's always an investigation that transpires to make sure that one of the things that I love, and I know Ben falls in this category, is trying to create a environment of compliance, buy-in to compliance, that we want people to be in a compliant organization, but that you feel comfortable enough to then tell us when something doesn't happen the way you think it should have. So it's always better, to Ben's point, to ask the question and then have conversation about it, so that we can learn from whatever might have happened. That's the easiest way for us to put in safeguards as well for our organization related to whether we need, like Ben mentioned earlier, security purposes, what are we putting in place to protect the information as we move forward? So without having us all work together on that, we can't do that in an efficient manner. So, Ben, I thank you for coming and sharing about this fantastic topic that you and I love to talk about so much.
Absolutely.
And most people don't, but we do. And so if you guys, again, if you have questions, let me know. And if we find that there's multitudes of questions, we can certainly invite Ben back if he's willing to come
Boy.
to do more of an in-depth question and answer for us as well.
Absolutely.
Any parting thoughts, Ben, or my friends here at the Dempsey Center?
Yeah, thank you very much for having me, and thank you for asking good questions. It's way more fun to do these overviews when people ask questions and we can discuss, because it's not an area that's totally straightforward. There's always going to be a new situation, so it's always good to talk it through. Good to virtually meet you all, and thank you for the work that you do. As I said, it's been awesome to hear more about the Dempsey Center, and sounds like the challenge a couple weeks ago went really well. So congratulations on getting through another year of that. But that's awesome. Right.
Great. Thank you, everybody. Have a great day. Ben